100%.
So okay, let me ask you a question too. So I think I know what it means, but I'd also be interested to hear a more specific definition. We kind of did this in another episode, but when you say neck cars, can you kind of give me a little bit? And I think I know what you mean, but like how, explain it to me as though I'm a patient. What are neck cars, man?
Yeah. So this is from the FRC or Andreo Spina people that came up with these crazy acronyms that they love. But CARS stands for controlled articular rotations. And basically it is a full expression of a joint or a series of joints, like a neck. If we could make it easier, we could talk about a shoulder, for example, but it wouldn't be just a circle, but it's also the rotation of the shoulder. So it's trying to take the shoulder through its maximum. Basically, if you think about a shoulder flexion, abduction, and then going behind you, internal rotation, and then can you unwind it, right? It's a maximum expression of controlled rotation, the key word being controlled there. So it's very slow. I think often they use, these words like, imagine you're pushing your hand through like some jelly or through some thick fluid, that you have to go that slow that you almost need a little bit of muscle contraction to get through it. But anyway, so if you take a neck and you have them start by looking down into flexion, I say, I don't care which way you go, but you're going to go very, very slowly and draw the biggest circle under control, with good pace that you can. And every time you feel something, some kind of discomfort, stop and tell me where it is. And so what happens is they'll often point either directly on the side at the point where they are bending to. So if you're bending into right lateral flexion, they'll point to the right side of their neck. They call this closing angle pain. And if you were in right lateral flexion and you felt it on the opposite side, they would call that open angle pain. And usually according to them, closing angle would be more indicative of like a joint or a compression issue. And open angle would be more tissue, fascia, ligamentous, muscular, some kind of tissue extensibility issue. So it's a really cool screen. At least for me, it can tell me where they pinch or pull. So if they point to the left side of the neck, no matter where their head goes, like something's going on with the left side of that neck. If they're always pointing always opposite of wherever their head goes, never where their head goes, I'm thinking, wow, they got some muscle tone issues going on here. And if it's all closing angle pain, you're really thinking more joint issues. But then you say, well, where do these joint problems come from? Why can't they do this? But I like the screen. I like this. It takes 1 minute tops, and it can just give you and I think John asked me once about the knee, where he said, where do you start? And I said, is it intra-articular or extra-articular? That's a quick question to say, is it articular or is it not? And it may not be always 100%, but it's a quick way to say, okay, maybe I got to think about these cervical joints, these Z joints or something, or you can go straight to checking out these muscles and muscle testing.
Yeah, no, that's awesome. And I like that because of the patient feedback really quickly. You get to tell them and then you can kind of explain to them a little bit more specifically. I like the idea in terms of like, the closing angle or the tissue extensibility on one side. I've heard it also kind of described as a hinge point. In other words, if they're side bending on the right, you would hope that each one of those cervical joint segments would evenly start to bend and or flex congruently, evenly. However, you're getting a little bit too much, kind of right where you're describing that kind of pinch. So sometimes you're like, that one, people would say, I need that joint to move. And yes, you do. But even kind of, old school James Syriacs, you need to check above and below. There are perhaps joints above that, ascending or descending, that also need to move. So it gives you a lot of information, I feel like. And I've used it a lot. The shoulder one is really good because we kind of touched on shoulders before, but like shoulder orthopedic tests don't really help me too much. And I should say relating to the patient. That's just kind of my speed and my style. But when the patient does that, then I can make an input to them, and then we can change that pretty quickly. And they seem to understand the connection between the test, what I do, and how they feel. All that just kind of works together. It's a great system, honestly. If you haven't seen each, if you haven't seen, you've been living in a cave. Sometimes you go to these guys' social media pages and you can see them doing kind of these crazy motions, crazy movements. But you need to understand that is, these guys have been doing these controlled articular rotations, pails, rails, right, for a long, long time. And that's kind of the very end of the spectrum. And really not, like we were saying earlier with all those patients and fast food, not everybody needs to be able to do a skater squat or a shrimp squat, right, with their eyes closed and their girlfriend standing on their back. It looks cool, but don't be turned off by some of the crazy stuff that they do, that you see on some of these pages. It's actually very simple. I won't say very simple. It's actually pretty straightforward stuff, if that's fair.
Yeah, for sure. I mean, the founder Dre, I think he's always kind of harped on that a bit. He's like, that stuff's cool, but listen, all we need to do is have joints that express their full ranges of motion. It doesn't mean you have to take them and dragon squat on top of them. Do you have adequate internal rotation and external rotation of the hip, and can you control it? And to me, it does not answer all the questions, though, but it is a fantastic piece that, I think John and I would both recommend.